Question number 1. The process of altering the state of consciousness induced by conditioning and skilled use of suggestions is known as Option A. Aversion therapy. Option B. Cognitive therapy. Option C. Hypnosis. Option D. Relaxation therapy. The answer is option C. Hypnosis. Question number 2. A brief description of an observed behavior or incident is known as Option A. Anecdotal record. Option B. Clinical record. Option C. Family record. Option D. Cumulative record. The answer is option A. Anecdotal record. An anecdotal record is a detailed, descriptive narrative recorded after a specific behavior or incident occurs. Question number 3. Which condition is also known as trisomy 18? Option A. Turner syndrome. Option B. Pateau syndrome. Option C. Edwards syndrome. Option D. Down syndrome. The answer is option C. Edwards syndrome. Trisomy of chromosome 18 is also known as Edwards syndrome, mainly associated with intrauterine growth retardation and low birth weight. Symptoms of Edwards syndrome: low birth weight, small head and jaw, unusual face and head, physical abnormalities, problem with eating, feeding, visualizing, and hearing. Types of trisomy 18. Full trisomy 18. The extra chromosome present in every cell of the body. It is the most common type of abnormality. Partial trisomy 18. Baby has only one part of the extra chromosome. It is of very rare type. Mosaic trisomy 18. Only 18 number chromosome is extra in the baby's body. It is also a rare type of abnormality. Question number 4. Hernial protrusion of sac-like cyst of meninges filled with spinal fluid is known as Option A. Rachis. Option B. Meningomyelose. Option C. Encephalocele. Option D. Meningocele. The answer is option D. Meningocele. Hernial protrusion of sac-like cyst of meninges filled with spinal fluid is known as meningocele. Meningocele is the one type of the spina bifida. It occurs due to failure of development of the caudal end of the neural tube, which results in protrusion of the neural sac. Folic acid supplements during the pregnancy helps to prevent these neural tube defects. Question number 5. Which of the following drugs will be administered to treat anaphylaxis? Option A. Sodium bicarbonate. Option B. Epinephrine. Option C. Atropine. Option D. Digoxin. And the answer is option B. Epinephrine. Anaphylaxis is a severe, potentially life-threatening allergic reaction that results in decreased blood pressure and shortness of breath. Anaphylaxis causes your immune system to release a flood of chemicals that can cause you to go into shock by sudden drop OD blood pressure and blockage of respiration by narrowing respiratory pathway. Adrenaline or epinephrine is given in acute anaphylaxis reactions. It helps in bronchodilation and increases myocardial output. And also IR reverses erythema and urticaria.